I'm pleased to be joined today on Health Beat by Dr. Aubrey Mwinyogle, a vascular surgeon at Faith Regional Physicians Services in Norfolk. And today we're talking about abdominal aortic aneurysms. So doctor, please tell us some more about this condition and what might be the causes of that.
Abdominal aortic aneurysm refers to a dilation or ballooning of the major blood vessel in the abdomen. There are certain risk factors that actually predispose one to forming an aneurysm. This includes smoking, which is a very important factor, and hypertension and high cholesterol. Signs and symptoms of this could include abdominal pain and sometimes back pain. The reason why this disease is important is because when you have a rupture of it, it can be highly fatal. About 50% of people will not make it to the hospital once it ruptures, because this is a major blood vessel in the belly. You tend to exsanguinate or lose all your blood volume before you get to the hospital.
What would tell a patient that they need to contact their physician?
Aneurysms tend to be asymptomatic until they reach a point where they are big enough to cause symptoms. So most patients actually end up being diagnosed of this because they've been in the hospital for other conditions and they've done a CT scan or an ultrasound, which tends to demonstrate that.
I see.
So to increase our ability to detect this earlier, we have some screening guidelines for patients who are greater than 65 years old with a history of smoking. They should have at least a one-time ultrasound at that age to screen for abdominal aortic aneurysm. And of course, if you have a family history, it could point to a possible underlying genetic factor contributing to the development of aneurysm. And in that case, you should contact your vascular surgeon or a primary care physician and discuss the possibility of having an abdominal ultrasound to screen for that.
I see. Good. Well, thank you for sharing that with our viewers today, and we want to thank you for being here.
Thank you for having me.
To learn more about clinic locations, specialties, and providers, visit frpsclinics.org.